Uh, I would definitely agree with Dr. Malpani that self-care and need of a website for a doctor is important. Because I remember 2 years back I was working with one company called Hospacks, which is into projects, and they come up with hospitals, and they were talking about integrating all the nexus of doctors and bringing all the doctors on one common platform. So there was one initiative which we did was going to each doctor and telling them that we will open a website for you. You don't have to pay for it. Whatever pharmaceutical company offers you, you just have to extend it to the website alone. So you get a website free, whereas you don't have to pay for it. But in Bombay, I remember from Kolaba till Borivali, we had approached almost 65 doctors, and the figure is that only 20 people even showed interest in it. So it's very difficult for every doctor to have a website and convince that he should be having his own website. Talking about innovation, I would like to talk about innovation because everybody here is talking about disruptive innovation and innovation. And Alair Health, which is a part of Alair Incorporation, which is Boston-based company, we are a $2.3 billion company. We have two streams of revenue. One is a medical device, and second is a health management. We're present in almost 25 countries. And in India, we are present from 2007 onwards. We have around 250 employees. We are doing almost $50 million here in India. From January 1, we have started our health management division in India, which will be working on two divisions. One is on patient care, that's self-care, facilitating self-care, and second is providing technology, that is point of care. So when we talk about innovation, there are three areas of innovation in healthcare. One is customer oriented. When we talk about customer, it is client convenience, low cost, and affordability, accessibility. That has to be kept in mind in a customer. Second, we talk about technology. When we talk about technology, it has to be low cost technology, low cost drugs, and obviously a very effective IT platform which a layman, a common person can access. Third is a business model. When we talk about business model, it has to be horizontal as well as vertical. When horizontal means like what Dr. Malpani and other doctors in Bombay or anywhere, they have a horizontal platform. But all doctors come together forward and provide a community services to poorly driven. Because if you divide the entire healthcare industry, I divide them into three segments. One is a 2%, which is very rich class, which are as rich as anywhere in the world. Second is a 30% middle class who are working in various corporations like us. And third is a 60% poor class who are completely dependent on the government for medicine. So, and then the second vertical is obviously the vertical integration of business model, where, for example, if I give example of diabetes, then all faculty and specialists, right from a diabetologist to podiatrist, ophthalmologist, all comorbidities has to be taken care under one shop, and which somebody coined a term called factories. So, but there are various factors and barriers for innovation in healthcare. One is the players. We have different players. We have big players, like there was the technology. I read an article where there was scientists who had come out with a nanocrystal technology for X-ray, which was basically taken from military, and because of X-ray being in the picture, and this was not licensed and the policy was not formed for it. Second part is funding. As Paul, organization like Paul, they need a lot of justification. Like we have a microfinance, we need to have microfunding also for people who are innovating and doing disruptive innovation. Then the policy obviously come into picture because any person who comes out with disruptive innovation, it has to be policy oriented, it has to be regulated. Then technology, customer and accountability. I'll go to the next part of it. Everybody is talking about disruptive innovation. I'll just take 2 slides of disruptive innovation. I just would like to tell you, this term, disruptive innovation, was coined by a professor in Harvard called Clayton. And he was talking about sustainable innovation and a disruptive innovation. I know most of you might be knowing about it, but this is for those who are not aware of disruptive innovation, who has coined this term, and how this disruptive innovation came into form. So all the big players, all the sustainable innovation or a big innovation, they need to improve on a regular basis. Like a Mahindra will come out with Scorpio now, Zylo. So this is sustainable innovation. Whereas disruptive innovation, which is low cost, which have a very low acceptance or need in the market, but still those innovation which can supersede a very strong player in the market. In healthcare, there are 2 sort of disruptive innovation. One is a disruptive innovation in an institution, where the focus from teaching hospital has come to outpatient clinic, and from outpatient clinic we are going to in-office care, that is X-ray from office to office. Now we are talking about in-home care. We are trying to provide everything at people's doorstep. So going from hospital or tertiary care and bringing 80% of population which is healthy to home care and office to office care is required in any sort of a disruptive innovation. When we talk about disruption of healthcare and profession, it is right from super specialist to a specialist. Earlier, CABG was since it's done by a cardiac surgeon, now angiography is done by a cardiologist. So from specialist to primary physician, the primary physician care has come to nursing care, and nursing care, as Dr. Balpani said, has come to a self-care, and that is what is the future. A technology-driven self-care is the future of healthcare. So I'll just share a small video. What Alair has done. Can you hear the voice?
Within any population, the prevalence of diabetes is about 3 to 4%, with the average diabetic costing an employer thousands of dollars per year. But personal health support is not about the average diabetic. It's about helping the individual who has been diagnosed with diabetes. Employees like Suzanne, she is 41 years old, a type 2 diabetic.
Can you hear in the last?
She's not exercising due to her embarrassment and being larger than everyone else at the gym. Suzanne has been working with
This is a long video.
It's a 2 minutes video, not even 2. I don't have much time.
Levels using her glucometer. The data is then transmitted to a leader for review by a nurse scan manager. Should the results be abnormal, the clinician monitoring the device data will make a call to Suzanne to ensure everything is okay or determine if action needs to be taken. Suzanne and her nurse care manager speak regularly. Her nurse suggests that it might be beneficial for Suzanne to enroll in a health coaching program. Suzanne and her coach have several conversations and an online chat. She is also excited to learn about Alir's online healthy living programs and enrolls in the Healthy Diet program. Why is it that acute events always seem to happen at night? Late one evening, Suzanne suspects she is suffering from a bad flu. She has also skipped measuring her glucose. Not knowing what else to do, she calls the Alir 24-hour Nurse 24 nurse line. The triage nurse pulls up Suzanne's record, and in moments she knows all about Suzanne, who she is, what challenges she faces, and the details of her care plan. The nurse and Suzanne discuss the symptoms of low blood sugar and determine that Suzanne is okay for the moment. Suzanne is relieved. The next day, Suzanne's care manager receives a notification that Suzanne called the Nurse 24 nurse line, and she accesses Suzanne's
Hi,
record.
how are you?
The care manager calls Suzanne on her cell phone, and they discuss the importance of measuring her blood glucose levels throughout the day. Suzanne makes a commitment to her care manager that she will more faithfully check her blood glucose levels and fill her insulin regularly. Suzanne continues to receive regular calls from one of the nurse team care managers to monitor her progress towards achieving the goals set out in her care plan. There have been great changes in Suzanne's life. She's lost 20 pounds, she has reached her goal to reduce her blood glucose levels, and continues to set reasonable and manageable goals that she can reach so that she can keep lowering her blood glucose over time. Her insulin dosage has been reduced by half since the start of the program, and she continues to work towards her goal of increasing physical activity and making dietary improvements. Suzanne is now well on her way to managing her diabetes, which is a significant improvement in her quality of life.
So, this is what Alair does. It develops a program around various diseases, especially diabetes, cardiovascular, COPD, asthma. Now, what does Alair is and what it does, it's basically improved from preconception to end of life across entire spectrum of healthcare needs, wellness and prevention, disease management, case management, and specialized services. We support the entire health continuum. We serve in the areas of both diagnostics as well as services. We have an innovative platform called Collaborative Care Solution, which integrate the physician, the technology, the IT, the service providers. So we call it a collaborative care solution, focusing completely on patient-centric solution, targeting the right people. We have our own enrollment process. We have a broad database, broadest healthcare data, which we integrate in our layer longitudinal records, which is personalized solution, which we give it to the employee. Remote patient monitoring through a daily monitor. We have a daily monitor which is put at patient home, and all the data from the devices are captured through Bluetooth. It comes to a console which is basically shared with the treating physician as well as allied physician. This is the data reviewed by clinician. Then we have a software, we call it Apollo software, which has an interface with the client, the health coach, the physician. We do biometric monitoring through data link monitors. We have a mobile app which make it a very user-friendly application for recording data history, which does the care coordination of all, that is point of care, data, layer functions. And the scope and impact is that we touch base with almost 200,000 active managed program. There are 680,000 active health portal user, 23 million individual covered for tobacco cessation. So these are all statistics globally which we do it. And that's it. We are basically committed to take care of patient. Our focus is completely patient-driven. And in India, we're trying to provide all the services in a cost of only 500 rupees per participant. This is what we're trying to achieve. Our first centers are going to come up from Noida, Delhi, and the second from Bangalore, Puram, by January 15th. So shortly we'll hear a launch from us, and we strive to achieve almost 50 centers by 2030. Thank you.
Thank you, Dr. Any questions?
This is employers will pay the 500 per employee per year.
There are two models here. If you see, start from screening. Basically, earlier is going to be an awareness management company where we create patient education. Those people who don't know a 50 plus that they have a prostate, we create the prostate awareness campaign. If you're asking the source of revenue, up to screening it will be paid by the employer. Post screening it will be paid by the employee. And now we are working with some insurance company and brokers. We have just engaged our services with 2 insurance companies and the broker, and we are coming out with a very low cost model where we can provide them call-based reinforcement every day, where a nurse will call and remind a diabetic patient that today 8 o'clock, 8:30 you're supposed to take breakfast, please take a medicine. So this is what we want to provide in a 50 rupees call-based program for you.
Thank you, Sumit. Can I ask Paul to hand over?
Yes.
Sumit?
Excuse me. Hello.